Good morning to everybody. Ellen Ayurvedic PG Entrance Coaching Center. In previous episodes, we taught you the concepts of Ayurveda in practical point of view, theory point of view, and even in PG Entrance exams point of view. Today's topic is truptighna dasemani dravyas, which are extremely useful in digestive system. In one way, these are the drugs which are useful in Rasavaha Samsthan, Raktavaha, Mamsavaha, Medavaha Samsthan. Otherwise, whatever you say, this is related to the circulatory system, even in nervous system, directly or indirectly. It is a new point what I am stressing here. How this will help you, you will come to know. What is truptighna? Dravyam truptim hanti truptigham. Going on eating one day, one fine day, what happens? You will come to know something deposited in the body. There starts the effect of those materials which are blocked, which are deposited in the system. Now, what is the thing we have to eliminate? How to eliminate them? See, for any disease in this universe, the intake of the food is the main cause and the climate is the second cause, otherwise ahara and vihara, whatever we say. And then brahmacharya, trayopastambhaka, is it not? So, this ahara will give you different effects in the system when you are consuming every day. Beyond the level consumed, it will have its own drastic effects. The diseases are obesity and obesity related diseases, arthritis, gout, and blockage of the vessels. At last, this will affect the heart and brain also. People think in a initial level or whatever you say in the beginning level, and they will conclude that these are useful in so and so condition only. No, it is not like that, but it is useful in higher level diseases, also deep root diseases like even in brain clots also these are useful. See, even in brain clots, how these drugs are useful in the sense, root level treatment this will start. Suppose obesity is there, section of the unwanted material may be the one of the recent and latest line of treatment. But our concept is that from the root level, starting from alphabet level, in the sense, this will subside the cholesterols and unwanted cholesterols or bad fatty contents in the body. You can ask me one beautiful question. Sir, what is this? I want so emergency treatment. That is why treatment at the complications level is different. Symptomatic treatment is different. What's going on today? And the root level treatment is different. The root level treatment is possible in Ayurveda. What I mean to say, you take simple obesity. The root level treatment is how long this will help you, how far you take. Months together you are supposed to take. It's not an easy task. See, we are improving the body weight in the body day by day by eating the wanted foods. Because you don't have the trupti, that is why you are taking, one fine morning you will come to know not to be taken. Through your food counselor, what to say, nutrition counselor, Ayurvedic doctors or any doctor, even allopathy. Go away with doctor is doctor. So in such conditions, what happens? If I am starting the root level treatment, sir, I will reduce your obesity, sir, I will reduce your vessel wall thickness, or I will reduce your blocks. Then what is the use in this case, in this venture? No use. But I want threat treatment. So one side you have to follow threat treatment, and another side you are supposed to follow the root level treatment. So there is a link between the root level treatment and there is a link between the emergency treatment and the complication treatment. Both three types of treatments they are supposed to go through. After going to three types of diseases, you have to continue the root level treatment. If you are not continuing the root level treatment, definitely lifelong it will be a subject treatment only. Okay, you tell me how long you are depending upon the root symptomatic treatment and emergency treatment. Once, twice, thrice. After that, you have to go for the root level treatment. Once you go for the root level treatment, definitely some positive changes will be there in the system. Definitely, starting from the digestive system, almost all the systems will be set right. That is the line of treatment. That is the line of treatment that is possible in the system of Ayurveda. So these are the important drugs of stress in obesity and other related diseases, especially truptighna dasemani. Apart from the lekani, dasemani, dravyas, these drugs are also useful in case of obesity related diseases. Let us see what are the Nagara. What is Nagara? Sonti. You take the intake of, we start the intake of the ardraka or sunti, any form, see the result. Then chavya, paper retrofractum. Chitraka, excellent drug which is useful in society today. Now we are, what is it? Chavya, Nagara, Chitraka, Vidanga. Vidanga is a root level treatment drug. People today we are neglecting Vidanga powder in market available in case of any worm infection. So it saturates the Rasavaga Samsthan, Raktava Samsthan, Medavaga, all these Samsthanas will be set right. But we will neglect because why we people are neglecting in the sense today we are following the symptomatic relief with threat level treatment, a complication treatment, then you are giving first the symptomatic relief, then only you are going for the root level treatment. You see, that is the drawback today. This is why there is no answer for how long. At least if you are following the root level treatment, after 6 months or 7 months or at least after 1 year, you can stop the treatment. See, whatever discussion going on, maybe the discussion without following the dietetic rules in a natural way. If you are not following the natural rules, definitely you cannot get rid of the problem. That is 100%. More by the and whatever by the system. Now Vidanga and Guduchi, what we are calling Tippatiga, this is Tippatiga Swarasa or Tippatiga Kashaya or Tippatiga Churna, Guduchi Churna, what we are calling. If you are taking, it works in different angles and supports your health. Next, Vacha Ecorus Calamus. Ecorus Calamus is an excellent drug. It is a Sangana Stapana Dravya useful in nervous disorders. See, what is brain, what is mind? Is it not? We both are different one or same one in the sense. See, how this Vacha will act on Rasavaga Samsthan, Raktava Samsthan, Medavaga Samsthan in an excellent manner and reduce the obesity in the body. And these dravyas will make you not to take the food intake. They will stop the food intake because they will reduce the taste and you will not have any taste to take the food material also, but you will have the normal lifestyle, nothing wrong in that. See, you start the Vacha Churna. Of course, Vacha, whenever we are taking Vacha, Equirus Calamus, under doctor's observation or supervision, you take. That is why people will ask me one question, sir, can you give guarantee and warranty, how long we have to take? See, everything depends upon the body, how it is supposed to the body, to support. Is it not? If the body is not supporting, treatment may fail. Treatment may fail. That is why you have to make the body to support. There are different stages are there. In which stage this body will support or not, that you should understand it through the experts. Then Vacha, Ecorus Calamus, up to 1 gram can be taken in divided doses. Guduchi also. See, the dose is not so. For the past 30 to 40 years, in my experience, I am watching books. See, in medical science, in 2 aspects you have to go through. Number 1, theoretical subject. Number 2, practical subject, or whatever is a clinical point of view. In clinical point of view, while fixing the dose based on the modern concept, they will do in 2 angles. Number 1, under controlled climate and uncontrolled climate. See, when you are doing a drug in controlled climate, when you are bringing to the uncontrolled climate, how far it works? May work, I am saying. I am not saying it is not going to work, but the degree may change. So that is why in the beginning itself I have told you how the drug works. See, that how the drug works depends upon the body. What is the disease power in the body? What is the drug power in the body? And disease power you have to find out, drug power you have to find out, And body power also you have to find out. It is a these are the Trayopastambhas. See, your disease power from your side, the disease from nature. So you have to think about the nature. And drug power, the drug is from the nature only. We are not preparing see, medicinal plants we are not preparing. We are cultivating the medicinal plants in olden days. See, olden days terms and in olden days terms and conditions related to the society are different. Today society's terms and conditions are different. If you want to cultivate a plant, you have to get permission. If you want to cultivate sell a plant, you have to get permission. Today in olden days, such a criteria is that marketing tendency is not there. They used to serve the people. They have served the people through the available drugs. Today rules and regulations are different. Okay, why I am stressing? See, for everything to follow the criteria may possible, may not possible. As the drugs in the system of Ayurveda, how they are going to work, if you want to know, you have to use it practically. See, when it is a toxic, think about. When it is extremely recorded side effects are there, you think it. Otherwise, you think that it may not suit to your body, that we cannot say blindly, doctor cannot say whether it suits or not. You have to use it practically. Now, come to Musta. Musta also an excellent drug, which is useful in case of staulia and obesity related dystolia or obesity related diseases. Then Pippali, Piper Langam also is an excellent drug. And Patola, see today you think about Patola, this Patola, Potlakaya, whatever is what I said now, is extremely beneficial in case of digestive system diseases, watermelon disease generally, and even in heart disease also it is extremely Patolam, Hurdyam, good. See today, how many people eating this Potlakaya, Patolam, it is a good in heart diseases. It is a good in heart diseases. Today, regularly, how I request the society to take the Potlakaya regularly, people will say, I left this in Kasi. What is this even? Nothing in following our tradition, our respect, to God. But when it is a diet, when it is having a medicinal value, definitely you are supposed to follow. Regularly, I request all the people to consume a Potlakaya, Patolam, as Patolam is a Hurdyam. In any Hurtvikara, in any heart case, but as a heart related disease, directly, regularly, like a medicine you are supposed to take, then see the result, some change will be there. Because your disease is mainly because of your diet only. When if you are able to separate the diet, the disease will come down. Otherwise, the disease will not come down. Till the last breath, we are depending on two types of treatments. Number one, threat treatment. Number two, symptomatic treatment. Root level treatment, we are not giving importance. See, okay. Now, Patola. So now these are the drugs which are useful, and these drugs have to be taken under doctor supervision. That is why I request all the MNCs, top corporate hospitals to introduce to these drugs, to incorporate in the sense to serve the suffering humanity in a natural way, where the diseases are based on the natural calamity only. In the sense, natural calamity outside the body taking natural calamity, you mean to say no, inside the body also, because of the natural calamity we are getting diseases, and because of the improper diet also we are getting disease. Saturate the diet, the problem will come down. If you are not changing the diet, the disease never comes down. If it all comes down, and then again when you are consuming the diet again, the diet will increase, the height will increase, and the weight will increase. Automatically growth is there. Growth is beyond the growth, and beyond the growth is nothing but again obesity and related diseases. See, there is a link between every principle. So from all the principles you have to subtract. Now we are coming to the, see what is the entrance in entrance examinations, Chitraka and Vidanga Guduchi. The following group is mentioned. See, the question may come like this. The following group is mentioned in truptighna dasemani. See, Nagara, Chavya, Chitraka is one group, and Vidanga, Guduchi, Vacha, Musta one group, and Pippali, Patola one group. Otherwise, negatively he may give, positively he give, all the or none of them, like that any question may come. So that is why, see, don't think that the subject matter what or the concepts what you are introducing to the society meant exclusively for PG entrance only. No, they will help you theoretically, they will help you practically, they will help you clinical point, they will help you in clinical point of view. So your practice is very, very important. Your prescription is every prescription is an examination for you. You feel like that. Every case is an examination for you. Remember your olden days when you studied, when you are in a graduation level, when you are trying for, now you are trying for PG, for example. When you are a graduation level, your bedside examination will be there in examinations while viva is going on, practical is going on, is it not? So, one patient is an examination for you. In the same manner, you have to treat every patient is an examination for us. Every prescription is an examination. Every patient's blessings are is award or nothing but awards for us. We have to feel like that. See, gaining is different. Automatically, God will give money to everybody. God will not keep even a single cell empty, because He will fill the cell box with something else to feed on its or her or his own accord. See, this is the God's gift for everything. That is why you give respect to the nature. Nature will give respect to you. Okay, now see just now one concept, principle. I have told you how the question may come. One of the following group is missing, or one of the following is present. Either positively the question may come, or negatively the question may come. You have to study vigorously, hours together. You spare time. See, that knowledge when helps, how helps, you cannot say. Wherever, whenever you are going out, definitely people are searching for Ayurvedic doctors. People are searching for Ayurvedic doctors, in the sense, if you are strong, I mean, if you are worthy with your rich, we are rich with your contents in your system, definitely you will be plucked one day or other day. Okay, now second part, I mean, arsoghna, second drugs, what we are going to do, arsoghna, dasemani dravyas. See, the dravyas are the materials are dravyas, are drugs which are useful in piles. Let us see, piles also today a common problem. See, kutaja, bilva, chitraka, kutaja, bilva, chitraka, nagara, kutaja, bilva, chitraka, nagara. I am repeating once again. Those are interested, they can take the concept also. Kutaja, bilva, chitraka, nagara, ativisha, abhaya, dhanvayasa, Fagonia critica, Daruharidra, Vacha, Chevya. Daruharidra, Vacha, Chevya. I am repeating once again. What are the important drugs in piles? See, practically in our dispensary, these dravyas we are using. Practically, these drugs in our dispensary we are using. These drugs are easily available. These are totally identified, confirmed drugs in the system of Ayurveda, can be used as they are available easily. We can use, nothing wrong with that. So repeat, I will once again. Vacha, Chavya, Daruharidra, Vacha, Chavya, Daruharidra, Dhanvayasa, Haritaki, Ativisha, Nagara, Chitraka, Bilva, Kotaja. Remember, every drug will have one specific action along with the other actions. Every drug will have one. That means, according to Charaka, whatever dravya that comes in, the same dravya may come under some other group also. How it comes up? Because he has observed. Practically in those days, he has observed based according to the surroundings and situations available in those days. So you find out, don't blame the system, or don't blame the doctor, don't blame the drug, because everything I have told you, the 3 points: the disease power, drug power, and body power. When the three concepts are in good condition, the treatment will be good. Otherwise, treatment may take time. That is why there is no answer or solution for how long. So no solution when we are having pollution in the body. You remove the pollution from the body. What is pollution again? Impaired, or what is it? Vitiated doshas, dhatus, and malas. Rajoguna, tamoguna, all the things. If you are able to maintain or balance in a proper condition, health will not be there. Otherwise, health will be there. So now today we have covered 2 concepts, 2 topics. Drugs related to the obesity or truptighna dasemani dravyas, and related aspects. And arsoghna dasemani dravyas, what are they? Kotaja, Bilma, Chitraka, Nagara, Ativisha, Abhaya, Dhanvayasa, Dharakaridra, Vacha, Chavya. So let us see, in case of any doubts, these are the important drugs. Even M.Pharmacy Ayurveda students can go for pharmacognostic studies, phytochemical studies, or what is it, clinical studies in these drugs. See, you find out, see, whatever research you are doing, that should be beneficial to the society. So when the society receives you after having some proper interaction, definitely they will get the benefit. Kalaha Paranamiti, without transformation of time, nothing is possible. That is why I used to tell doctors are only physicians, they are not magicians. We cannot do any magic. Whatever the system, whatever the system, they are 100% physicians only, no doubt at all. They may have, or we may have super specialist category or cadre, super specialist courses. We cannot do any degree of magic. So that is why you have to follow the treatment aspects from the root level. If you are able to follow treatment to root level, definitely you will get rid of the problem. Now we have covered two topics. In case of any doubts, contact our classes 9014141722, because now I think very this academic year PG entrance examination is over, almost going to be, where it's very near, I think so. Let us plan for the next year long term classes. Those who are interested for long term classes, see, in our presentations through our organization, you will have the herbal garden observation also. Through you will have the, wherever we are having tie up with different herbal garden, observe herbal gardens, there we will go there and see the medicinal plants also. We will see the medicinal plants also in our classes. Theory part will be there, practical part will be there, and the clinical points wherever you are attached there, there you can see. But we will give you the fundamental morphological or anatomical or histological concepts for confirmation of the identification of that, and you will be in a position to do on your own accord. In our regular classes, what I see, that it will be different. When you are attending the classes regularly, the subject matter will be different. See, I think you can understand very, very clearly the subject matter, everything cannot be kept on the screen so easily. Is it not? Fundamentals we are going to keep in practical, to have the practical approach or to have a better clinical approach for drug selection. You can contact us in case of need. Have a given number. Today's topic is over. Thank you for your sparing valuable time. Subscribe and see how we are going to get it. See, really, if you want to crack these seats in best reputed organization, colleges, medical colleges in India, you study, getting a PGCD is not a big issue. You will get it. But based on your standards in a regular stream coaching, getting in a better and reputed and government sector colleges where more people are there, there you will have the more knowledge. See, ultimate aim is to get the knowledge. If you are not having the knowledge, I mean, what I mean to say, not visiting or observing the patients, your knowledge will be theoretical, is it not? So be practical. So select the best college, be topmost, be a topper to get the topmost, to get the seat in topmost college. Thank you.